What's up, good people? How are you doing? Hope you're well. Welcome back to my YouTube channel. My name is Jemienaftaly. I am a pediatrician by profession. It has been a minute, yes, but now I'm back with another video just for you. Here, get to be enlightened, to be educated on common illnesses affecting children while growing up. I want to enlighten and also empower everybody, especially the mothers, because they are the key caretakers of these children, on what really happens to these children while growing up, the common illnesses they get while growing up. So if you are new, welcome to this family, because this is a family. Join the family by hitting the subscribe button. Subscribe to be part of us. If you're that returning subscriber, thank you so much. You are a favorite person. You don't even know it yet. Thank you for always coming back to watch my content. So thank you so much. Let's go to the video of today. The video of today, I want us to talk about something very serious in children we call birth asphyxia. Birth asphyxia, this is a condition that we normally get immediately the child is born. So first of all, let me say this is the second commonest cause of neonatal mortality. A neonate is that baby that has been born. A neonate is a baby from 0 years to 28 days. So these are the children that we are talking about. So mortality are death. So we are saying it's the second common cause of death in neonates. And this is very, very serious. So which is the first one, if I may just mention? The first cause of death during birth, after the child is born, is we say they are infections. These ones carry around 32%. So now birth asphyxia, the topic of today, becomes number 2 cause of neonatal deaths. Yes, this one takes around 29%. The third commonest cause of death is prematurity. Remember, a premature baby or prematurity is that baby that has come before the 37 weeks of gestation. Remember, we normally say the normal is 37 to 40 weeks. Yes, we say in terms of weeks. So if this baby happens to come earlier, that is 33 weeks, 30 weeks, this is a mature baby. This is now prematurity. It carries it becomes number 3 and carries around 24% of this mortality, of these neonatal deaths. Number 4, we have congenital causes. Congenital are conditions that children are born with. They may be born with congenital heart issues. So these are Down syndrome. These are some of the congenital causes that we say this carries 10%. And now the 5% are others. So I just wanted to show you, to give you a picture on how dangerous this topic of today is, the birth asphyxia. It is number 2. It is number 2 from the top list of causes of neonatal deaths. So now let's go and know the definition of this birth asphyxia. What is birth asphyxia by definition? This is the reduction of oxygen delivery, and in return there is usually accumulation of carbon dioxide due to the cessation of the blood supply to the fetus during birth. So what we are saying is that there is not enough oxygen supply, then the carbon dioxide now takes over, and we know the air that everybody breathes, the best air is the oxygen. So the carbon dioxide just comes and takes over, and this causes the cessation, or there is no blood supply to the fetus. Yes, and this is during birth. See, this is what we call, the two things are the low blood supply. First of all, the low oxygen delivery and also the low blood supply. They go hand in hand. Blood is the one that carries oxygen. Yes, so if there is no these both two things, then we have a problem. So in return, we normally get no spontaneous breathing at all, or if there is, we normally get irregular breathing, and this is due to this hypoxia. Hypoxia is the complete lack of oxygen. There's no oxygen at all. So then we do not have any spontaneous breathing. So when we say that a child did not cry immediately after birth, remember, a cry is a sign of life, because now after the child comes out of the abdomen, we expect these babies to breathe the air outside, and the lungs open up. Now this child cries, and this now indicates that this child is alive. This is a sign of life. That is what we are saying. So if there's no that spontaneous breathing after the baby has come out, or it is there but very, very irregular, now we have a problem, and this is what we are calling birth asphyxia. Now, what are the causes of this birth asphyxia, or the risk factors to this birth asphyxia? The risk factors are classified into three. So we normally have the maternal causes, we have the perinatal causes, this is during birth, and also we have the postnatal after birth the causes. So let's start by the maternal causes. So number one, we are saying is the hypoxia, lack of oxygen to this mother. The mother is pushing this baby and they don't have enough oxygen. Definitely we are going to give birth to a baby with, again, birth asphyxia. If the mothers have got anemias, anemias are low blood levels in the blood. They have got low HB, as low as below 5. So if we have got anemias, the chances of getting a child with birth asphyxia is very, very high. It's a risk factor, the anemias in the mother. If the mother is diabetic, again, it's a risk factor. If the mother has got hypertension, it's a risk factor again. If this mother during pregnancy was smoking, so be very warned, mothers, if you are watching this video, when pregnant, please no smoking, no taking of alcohol, or these things are predisposing us to these risk factors of many things. It's not only birth asphyxia, but alcohol intakes and also smoking while pregnant. We have seen before that this will create problem to these babies after birth. So if the mother has got, again, heart diseases, this again is a risk factor to birth asphyxia. Extreme of ages, yes, if the mother is too young in terms of age, and also if the mother is too old while giving birth. So these two extreme of ages will give us a risk factor to getting an asphyxiated baby, birth asphyxia. Also, maternal infections, we have things like maybe UTI, yes, urinary tract infections might give us this birth asphyxia. We have something we call postdatism. We said that the normal weeks gestation is 37 to 40 weeks. So if this mother is about 40 weeks again, then and they gave birth, they are at 40, 41, 42. Now these are postdatism. They are post-term. This is what we are calling postdatism. Now those are the maternal causes, or the risk factors, maternal causes of birth asphyxia. How about perinatal causes during birth? So if we have got things we call a placenta abruption, if we have got placenta previa is a case whereby we have a low-lying placenta. The placenta is very, very low. This might give us an asphyxia in this baby. If we have got something we call prolapsed cord, this is very, very common and it's very dangerous. The baby during birth, the cord is around the neck. You can imagine it's all over around the neck. What happens is that when this mother is pushing, now this cord is tightening the neck and it's strangling the babies, and now we do not have the blood supply and the baby comes out blue. This is what we call cyanosis, and eventually we get birth asphyxia. So very, very common, prolapsed cord. If we have got use of GA, that is use of general anesthesia, it has been marked to have to be a risk factor in birth asphyxia. What about the postnatal causes? These are multiple births. If the mother has got multiple births, if we have congenital malformations again. So these are some of the risk factors to getting a baby with birth asphyxia. Hope you get so well. Now, going forward, when babies get asphyxia, what happens? They undergo two events. This is like, we call it pathophysiology, or how this birth asphyxia comes about. So they undergo two events. First we call primary apnea, and also we have secondary apnea. Apnea is total. They do not breathe at all. So first, primary apnea, what happens? There is oxygen deprivation. There is no complete lack of oxygen. In return, we get rapid breathing. The baby starts breathing fast, very, very fast. Then we have got respiratory movements. We get the respiratory movements are going low, they cease or they stop, then we get heart rate that falls, the heart rate again falls, then the muscle tones diminishes, they become so floppy. When you hold the hand of this baby, it just falls off, or even the leg, so the muscles diminish in terms of tone. So this is what happens in primary apnea. Then we go to secondary apnea, whereby we have got deep gasping. What is gasping? Gasping is a situation whereby the baby completely does not breathe, then all of a sudden they that is now the gasping. So I think that is the best demonstration I can get. So the baby doesn't breathe, then at some point they just provide that sound. This is what we call deep gasping, and this is now in secondary apnea. Then we have got heart rate falling even more. In primary apnea, the heart rate falls, but in secondary apnea now, it falls even more. Yes, then the BP falls also, it comes down, the BPs, they become flaccid, then the respiratory becomes weak, and eventually we get the last gasp. So they gasp another one more time, and from there is not even that gasping. Unfortunately, we have lost that baby. When they give their last gasp, it is too sad. It is too sad that now that baby, we lose them. It is the last thing to do. So this is the pathophysiology on how babies, what happens until the baby now no longer breathes as a result of the low oxygen supply we are talking about. Now, what is the evaluation? How do we evaluate these babies? We evaluate the birth asphyxia from the APGAR score. Yes, if you really follow and you really watch my videos, I have done a video not long ago about the APGAR score, sorry. So please visit, go check a video I did on the APGAR score. You see, they go hand in hand. So APGAR score is what we use to score or to evaluate the baby. We score these babies after birth. That is what we said. You can go back and see what APGAR, the name APGAR, because every letter has got its meaning. I will not repeat here. Please go to that video on APGAR score. We score these babies immediately after birth at 1 minute. We score at 5 minutes. We also score at 10 minutes. So this is how we are able to evaluate. So what are the interpretation? So if a baby scores 8 to 10, 8 to 9, then we are happy. This baby does not have asphyxia at all. We do not have problem. We smile. Then what do? We just provide the warmth. We provide the routine care of the newborn. Again, I did a video on what routine care we do to every baby after birth. Again, go check about the routine care. So we give the routine care, we provide warmth and all that, and then we give the baby to the mother to start breastfeeding. So that is a score of 8 to 9. We are happy. We have got no problems at all. Now, if a baby scores 4 to 7, we call this now mild asphyxia. Yes, this score is a bit low. So we say that this baby has got a mild asphyxia. What we do, we provide stimulation. Stimulation is we wipe. We want to wipe the baby. As we wipe the baby, we are stimulating and we ensure the baby cries. And eventually, these are the babies that you want to support with oxygen. We may put oxygen to try and support them. And later, when the baby can breathe by themselves and they are okay now, we wean off this oxygen. That is a score of 4 to 7. So 4 to 7, we have got mild asphyxia. Now, how about a score of 0 to 3? That's a poor score. That is a poor score. And now this is the severe birth asphyxia. This we have severe birth asphyxia, score of 0 to 3. And here we need extensive resuscitation. So again, a video on neonatal resuscitation. You see, these topics go hand in hand. Go check on APGAR score, go check a video on neonatal resuscitation again, go check a video on newborn routine care, because I've done all these things and we can see these are the same terms, the things that we are still mentioning. So just go and check for you to get enlightened and also to understand even better. So a score of 0 to 3, we are saying this is severe birth asphyxia. Now, how do these children with severe now birth asphyxia 0 to 3, a score APGAR score of 0 to 3 present? So clinical presentations, we are going to find that the clinical presentation is going to be all over in every organ. Every organ, if a baby gets severe birth asphyxia, every organ is involved. It is sad to say this. Every organ is involved. Like for example, in the brain, the CNS, we call it the CNS, the central nervous system. What happens there? We have things we call intracranial hemorrhage. These babies start bleeding in the brain. They get cerebral edema. Yes. They also get convulsions. Yes. The seizures. In layman, we can say the tremors. We have talked about the convulsions. How about in the heart? This is we call the CVS. The cardiovascular is the heart. Normally, they have got increased heart rate, increased or even low heart rate. They can have bradycardia. They can also have tachycardia. So all these are terms used to mean high heart rate or even low heart rate depending. We have things we call arrhythmias in the heart. The heart beats in abnormal way. We call them arrhythmias. We also have got hypotension. The BPs come down. So we have hypotension. All these is what happens in the heart. How about in the lungs? We call it respiratory system. So in the heart, we get the RDS. Again, we have talked about the respiratory distress syndrome. In the lungs, we have the RDS. We get cyanosis, the blue discoloration of either the extremities or even the whole body. This is what we call a cyanosis. We also get that. In the KUB is for the kidneys, the ureters, and also the bladder. Also, it's affected when the child has a severe birth asphyxia. So here we get something we call acute tubular necrosis, that is in the kidneys, in the ureters, and also in the bladder. In the GIT, that is in the stomach, they get infections of the stomach. We call them necrotizing enterocolitis. A bit difficult, but this is what we call. Just know these are the infections of the stomach. In the hematology, that is in the blood system, we normally get DIC, the disseminated intravascular coagulation. Yes. How about the metabolic? We get hypoglycemia. We can also get hyperglycemia, either low or high blood sugar levels. Also hypocalcemia. So the calcium again can become also low in the metabolic system. Now, how do we go managing this asphyxia? What is the management of the asphyxia? Number one, we want to monitor the normal. We want to maintain normal temperatures. We don't want these temperatures to be, we don't want the babies to have fevers. We don't want them to have hypothermia. So we want to maintain the normal temperature. We also want to maintain normal oxygenation. So remember, keep measuring the SpO2 is what we use to monitor the oxygen saturations. It should be between 90 to 95%, and this we have said so many times. If a child is saturating below 90, then this is a baby that needs to be on oxygen, and this is a bad sign. Maintain normal tissue perfusion. So we do not want these babies to get dehydrated. So we want to put these babies on IV fluids, the intravenous fluids. So we want to maintain perfusions and avoid dehydrations. This is what we mean by maintaining tissue perfusions. We want to maintain pH at above 7.2. Yes. Treat the seizures. Most probably when you go to hospitals, these children that had birth asphyxia, severe one, we normally put them on anticonvulsants because they get tremors. We get those convulsions so oftenly. So treat the seizures, the convulsions using the anticonvulsants. We also want to these babies to be reviewed. They need nutritional review because we need to feed them well. Routine care, we talked about that. What we need to do to these babies, go check a video on the routine care like I said. Give oxygen to these babies. Here it is when we were doing normal oxygenation. We want to give oxygens. These babies may need something we call CPAP. So all this is to try and help the babies to breathe. So having said that, what is the prognosis of this severe birth asphyxia? How do they progress after that? That is the meaning of the prognosis. How do they proceed after that? What are the The predictors of poor outcome. Number one is failure to establish respiration by 5 minutes. Remember, we said the APGAR score is at 1 minute, at 5 minutes, and also at 10 minutes. So if we don't establish respiration by 5 minutes, this is a poor outcome. This is a predictor of a poor outcome. If the APGAR score is 3 or less at 5 minutes, so we said 0 to 3, this is severe birth asphyxia. This is a poor outcome. It's a predictor of a poor outcome. If there is an onset of convulsion or seizures within 12 hours of life. If within 12 hours of life after the baby is born, we already started convulsing, this is a poor outcome. If there is inability to establish oral feeds by 1 week. So if these babies are still on IVFs, because these are very sick babies, they cannot breastfeed on their own. So what we do, we want to keep these babies on intravenous fluids. So if these babies are still on the IV fluids, is what we are saying, by 1 week and after, then this is a poor outcome, because we expect 2-3 days of IVFs, these babies start coming up well, and we start now feeding on the expressed breast milk or even breastfeeding. So if at 1 week we still are on IVFs, then this is a predictor of poor outcome. Abnormal EEG. Every baby, because of the convulsions, every baby with severe birth asphyxia, we need to do an EEG. So majority of them are usually normal. The EEG is normal, but if you find an abnormal EEG, then this is a poor outcome. Then we have an abnormal CT scan of the head, and also something we call the MRI, the magnetic resonance imaging. So if we get abnormal things, all these, the CT scan is abnormal, the MRI is abnormal, the EEG is abnormal, and all the things we have talked about, then this is a poor prognosis. This is a predictor of poor outcome. So this is it about the birth asphyxia. Now you have the knowledge, you know how we are able to interpret, how we are able to classify, and we say it's by the use of the APGAR score. So it's the APGAR score that helps us to classify the birth asphyxia. You have seen how dangerous it is. Remember, we said it's the second in the list to be the commonest cause of neonatal death, the neonatal mortality. Hope this is clear. If you have got questions, please go to my comment in the comment section. Also, my email is provided at the end of email. Thank you to those who have asked questions, who have asked me to do certain topics. I'm still on it. I will still do them. Thank you for all these feedbacks. If you're new, if you have not subscribed again, please subscribe to be part of us. We are headed to 5K subscribers, and I'm happy, and I believe we reach there. So more videos are on the way, they are coming. So keep tuned always and watch my videos until the end. Turn on your notifications to know every time I'm posting a new video here. Thank you so much. Until next time. Bye-bye.